In ancient times, man was afraid of lightning. The modern-day man, in the same way, is afraid of an intervertebral hernia. In both situations, it is the fear of the unknown. It is important to know more about such a problem, for example, an intervertebral hernia, in order to get rid of the fear of it. So let's take a look at the human body, the amazing fact that it has the ability to regenerate, that is, to heal itself. But some organs aren't as capable as others at regeneration. One of these organs is the intervertebral disc. Let's take a closer look at it. The intervertebral disc consists of two parts, the inner nucleus pulposus and the outer fibrous ring. The nucleus is the soft part of the disc, specifically responsible for shock absorption while walking. The fibrous ring is more elastic. It serves as a shell and needs to be very strong, as sometimes pressure inside the disc can rise to 20 atmospheres. As we have already said, recovery of the disc is slow, and all because the intervertebral disc does not have blood vessels through which it could receive nutrients. The only way to ensure the metabolism is diffusion. In other words, penetration of nutrients from vertebral bodies to the disc. It happens during mechanical and rhythmic compression of the disc. Simple walking can provide it. When a person sits or stands for a long time without any movement, intervertebral discs begin to starve and age, and inside, microfractures appear in them. Scientifically, it's called degenerative change. Such discs can no longer bear habitual load. With increase in the pressure, the nucleus pulposus begins to penetrate into the microfractures and expand them. Ultimately, this could result in the rupture of the outer ring of the disc and occurrence of an intervertebral hernia. Instant signal of damage causes our bodies to initiate an operation to restore a failed organ. At the site of damage, there's an inflammatory response, leading to the gradual growth of blood vessels and nerve endings into the hernia. Vessels fulfill the transportation function. Through them, the body delivers immune cells, macrophages, and the nerve endings are required to control this process. Sometimes macrophages inside a hernia are assembled in such a large number it may even increase in size for a while, but as they feed on the hernia, its size will decrease. This whole process is known as resorption of a herniated disc, and it is a natural mechanism for self-healing of the body. The only thing that can be done in this case is to create all required conditions for the process to be quicker, more effective, and most importantly, pain-free for the patient.